there's a lot of similarities, but that's part of our specialty. It's cool. So we got to know what those similarities are. Ferrets, for example, are a lot of times they use those as research models for human vomiting because their stomach, upper GI has a very similar response to medications as ours does. So they use them for a lot of GI research.
Welcome back to the Animals at Home podcast. My name is Dylan Perrin, and thank you so much for tuning in today. I know it's been quite a while since I've recorded an episode. If you listened to the last episode, you guys know that I was planning on taking about a month off here in September, which I did do, and I actually really enjoyed. I very rarely take some time off, with my actual full-time job in the podcast. I'm incredibly busy, and I made the decision to really not do anything for a couple of weeks in September, and it was amazing. I also got to go out to Toronto for the Canadian Reptile Breeder Expo, which was an unbelievable experience. It was great to see the animals and whatnot, but it was amazing to see people, hang out with other reptile people. I'm very insulated where I am, insulated in Manitoba, and I don't get out very much into the reptile community. We have a very small reptile community here. So it was great to meet people and to meet listeners of the show and to meet friends who have made through the podcast. So if I met you on that weekend, then it was awesome to meet you. And if I didn't, hopefully we have a chance at some point to meet in the future at some other reptile event. And as I said on Instagram maybe a week ago, I may have broken the rule of or my streak of not buying a new animal. I haven't officially broken the rule yet, but I'm very close to do. Sure, it's not a rule, but I haven't purchased an animal since 2018, a new animal. I only have these 6 animals, the only 6 animals that I've ever had, and I may be getting another one. More on that at some point in the future. If you're watching this on YouTube, you can see around me that things are evolving. My next job is to properly set up the enclosures behind me, and I also have a couple more coming up. And then there will be YouTube videos. I've already filmed them. They just need to be edited. And I was kind of planning on having those out in September, but then I just decided to really unplug and enjoy some time off. So there are some incredible videos coming out building these enclosures, and we're going to be setting them up properly. There are animals in them, but they are not set up properly. They're just in there so I can get the old enclosures out. But anyway, all of that is not important. Let's jump into the actual first episode of the fall. I'm very excited to introduce Dr. Rob Koch to the podcast. Dr. Rob Koch is the Senior Director of Veterinary Care at the San Antonio Zoo in Texas, and he is a wealth of information. I imagine we could record several podcasts to get all the information out. We discuss his background, how he got into veterinary care. Of course, we discuss what it's like to be a zoo vet, which is different than some of the clinical vets we've had on in the past. So the role is, there's some similarities, but also you're dealing with zoo animals, so there's some differences as well, and I found that to be quite fascinating. We discuss working with venomous snakes, what that's like, how you do that safely. We discuss quarantining, which is something that I'm not even sure I think maybe we've covered on in the past before briefly, but he talks about how they do it at the zoo and what are some main tips that we should be doing in our home collection and how we can make sure we're quarantining our animals successfully and making sure we're keeping things clean. We discuss vet medical procedures, surgeries, some of the innovative things that Dr. Koch is doing, like acupuncture and some really amazing, interesting ways to bandage wounds. He talks about a project that I shouldn't call it a project. He's reviving a tortoise that was, I believe, hit by a car and massive injuries. There are some pictures in the YouTube video. If you are watching on YouTube, if you're listening, you can come back to the YouTube video. They will be time-stamped. And I'll tell you right now, the pictures are quite graphic. So if you're someone that's a bit queasy, you may want to make sure you don't, you kind of look away during those points. But he talks about how he uses this special vacuum bandage in order to heal the shell. It's really incredible. And then we just discuss vets and the reptile hobby and what are some of the issues that are there and some of the tensions that come up through that relationship between us and vets and just regular hobbyists. So it is a fascinating conversation. Like I said, there's probably so much more to get from Dr. Koch, and we'll have to do that in a future episode. But until then, if you're looking for more information on this podcast episode or any other episode on the network, if you aren't aware, there's other shows that are part of the Animals at Home network. So if you're not subscribed on Spotify or Apple, make sure you do that so you can hear and listen to those other shows. They are amazing shows. I love them as well. So head to animalsathome.network.com for more information about the network. You can also, it's been so long since I've done this, I kind of forget what I say. If you want to support the podcast on Patreon, you can do that at patreon.com/animalsathome. For as little as $3 a month, you can help support the show, and you can be part of the Discord channel and help recommend guests and whatnot. There's a bunch of different perks there. And really, the easiest way to help support the show is sharing on Instagram and Facebook. And finally, thank you so much to CustomReptileHabitats.com for sponsoring this podcast. If you're looking for new reptile-related equipment, make sure you head to the affiliate link in the description below. That will be a link that if you do make a purchase, a small commission comes back to me at no extra cost to you. You can see these are custom reptile habitat enclosures behind me, and we will be doing full builds and full descriptions of these at some point very, very soon. That is enough from me. I'm sure you guys are just excited to hear the guests, so let's jump into the interview with Dr. Koch. Dr. Koch, welcome to the podcast. Thank you for being here.
Thanks, Dylan, for having me.
I'm looking forward to chatting with you. You know, I love talking with vets. There's so much information that we can pry from you guys, so I can't wait to get into some of these topics. Plus, you have a little bit of a different background or different profession, we can say, than some of the other vets I've had on, so that will be interesting as well. So why don't we just take a couple minutes to bring the listeners up to speed? Maybe you could just give sort of your background on education and where you are professionally right now working.
Yeah, sure. I think we have a couple hours to go over that, right?
Yeah.
I've done
How many pages of the resume?
It's like 10 or something. I don't know. And that's a short one. I think I double that.
Yeah.
I growing up, I guess I can go over that too. I grew up with a mom that didn't like things that had scales or slimy in her mind. So I was kind of reptile deprived. But growing up in West Texas horn lizards are awesome. As a kid, we caught them. I mean, they're all over the place. The red ants were out there, we'd watch them eat, pick them up, play with them. Of course, back then I thought they were this giant lizard because, back then my hand was tiny. So I thought these little lizards were giant. And now as an adult, I look back and going, oh, they're so cute and tiny.
Yeah.
But, when you're like 4 or 5, they're like these huge giant lizards that are really cool. So, oh yeah, it was so much fun playing with them back when I was a kid, catching the anoles and things like that. Fast forward a little bit to undergrad at Texas A&M. I got the bug, as you can imagine. So I ended up getting some undergrad. I had dart frogs. I got the chameleon. And that just started everything downhill after that.
Yeah.
So this was back in the days of Usenet groups when everything was type on, and somebody was offering veiled chameleons that had metabolic bone disease, that was physically had abnormalities, if you will, and they rehabbed them with the vet and got them up to speed, but they were looking at finding a home. And I think at the time I spent with shipping like $150, which back then veiled chameleons were like $300, $400, $500. Way back. We're talking 93, 4, somewhere in that time frame.
Okay.
So pretty early. And that was it. That was Bubba. He had lots of issues, but he lived with me for 8 years. So that was.
Do you know how old he was when? Did you have a guess of how old he was when you got him?
He was about 6 months, but he was about the size of a 3-month-old. So he was pretty stunted. And he, rehab wise, he actually did fine. He had a curve to his interglossal bone, the bone that's inside of their tongue. So it's curved. So he never could actually shoot his tongue and eat. So, he's one of those that turned to more of a pet type chameleon because he liked to be hand fed and had to feed him in a cup and make arrangements for him to eat. And that started the whole reptile disease, if you will, or the condition where we all get reptiles and starts off a few, then ends up being hundreds. So you know how that could be. Yeah. But yeah, that started in undergrad.
Was your undergrad reptile focused at all, or were you just doing sciences, or how did that fold in?
I was biomedical science, actually, which at Texas A&M, it's cool because they have a undergrad called biomedical science in the College of Vet Medicine, but it encompasses all the medical sciences, from podiatry to human medicine to veterinary medicine to dentistry. So it rolls into everything. It's kind of almost like nowadays you'd almost consider it like the one medicine, where they talk about everything's comparative and just a continuum of the same medicine. So it's kind of like a part of that. And one of the largest actually colleges in the because it does encompass everything. So it's pretty cool. I mean, I got a lot of background stuff. I only did 2 years of undergrad. Then I went on to vet school, which is pretty, I guess, different. I kind of had the grades, and by the time I finished my second year, I was already past a junior in hours. So it's a little crazy.
So you actually didn't need an undergrad degree to apply for vet school, because that's not typical, right? Or
that it's not typical. I had the grades, and that made kind of the difference. And at that time, in the early '90s, they changed the curriculum up a little bit, so I kind of fell in the gap of being able to apply early, if you will. Nowadays, most people do 4 years. I guess I was a little overachiever and did it in 2. So a little crazy, but it worked. I graduated vet school when I was 24. Believe it or not.
So did you have a pretty strong idea that you wanted to be a vet even during those first 2 years of the undergrad, or did that develop throughout that time?
Now you're going to get the funny story. Okay.
Okay, excellent.
Now, growing up, my sister, who's a few younger than me, she always wanted to be the veterinarian. I was always the one digging in the dirt, playing with lizards, playing in just dirt and everything. I loved archaeology, I loved geology. I loved all that stuff that, kind of like environmental based, if you will. Well, come to find out, I'm the one that became the veterinarian, and my sister has the archaeology degree.
Oh, wow.
So we completely flipped our careers.
That's funny.
So it's kind of one of those funny stories, but it was a natural progression for me. We had birds growing up. My parents raised finches. We had fish tanks. We had a parrot. We had dogs. So I was always around animals. So it never really solidified in my mind that was my true career path. I just took it for granted that I was an animal person. Then my dad sat me down one day, and we talked about it, because he always wanted to be a veterinarian too. He ended up being an accountant. Then it really kind of was like, yeah, you're right. I guess it does kind of make sense that actually might be my true career path. Because I worked in a pet store in the '80s. Take care of reptiles, believe it or not, and fish, and I never really truly realized that was my real passion, because I loved it. I absolutely loved it. But of course, I was the math science whiz kid, so everybody's like, "Oh, you got to be an engineer, you got to do this, you got to do that." So that's the path that I was told to be on, if you will, and that's the focus. And it just epiphany hit me one day, and I was like, "No, I think I want to go somewhere else." And I worked at a vet clinic. I volunteered some time, and working in a vet clinic has just made sense. It really made sense. Even at 2 and 3 o'clock in the morning, cleaning up parvo diarrhea cages. It's like, I could be doing something else, but I could deal with this. This is actually pretty cool. So it's like the favorite glove, pair of pants, or something that just fits. And it just for me, that's, as I kept going towards it, it just fit more and more. And I was like, wow, I should have been doing this my whole life. This is awesome. So luckily I found out before I started college, at least, that was my path. And I haven't looked back since.
So did you basically jump right into exotics, vet med as well? Or, obviously you have to go through vet school and you get to taste everything, but were you headed that direction pretty much from the get-go?
When at the end of high school, I started working at a vet clinic who had, is a unique vet clinic. It had a pet store, a grooming, boarding, and a vet clinic all in one. And I was hired on initially to take care of the pet store stuff. I was a pre-vet student, and of course, there's a lot of pre-vet students that go on. So, and I had some experience in pet store stuff, so they had me take care of pet store stuff. But of course, they they cross-train you a little bit of everything, so I got to do a little bit of all that. Then it just seemed I kept migrating over to the vet side too, and just the experience I kept building that part of the experience. And they did mostly dog and cat, but they saw exotics there. And just with the exotic pet store, they had fish and saltwater fish and birds and a few reptiles, not much, mostly birds. It just kind of was those things that I kind of wanted to see the exotic side of things. So, going into vet school, I was like, okay, I'll be a model vet, do exotics, kind of like this practice I'm at now. And, it's a cool job. I like it. I really I tend to migrate more towards the exotics. And as you can tell, the more I kind of got into it, the closer I got to exotics. And even in vet school, I mean, we don't get a whole lot. We get a little bit of this, a little bit of that. And I kept going towards that. And when I got to my senior year, I really tried to focus as much as I can on exotics. Then the cool thing is that after I got out of school, I had a choice of two jobs, essentially. I could work at a private practice, saw over half exotics, so I would see a good part of that potentially, or I can go into a practice that saw almost no exotics. And it's another one of these funny stories. I interviewed at both places, and so do I want a piece of the pie or do I want the whole pie for exotics? And come to find out, I didn't know they were classmates. The two vets were classmates, owners.
Oh, wow.
So they kind of talked, and years later, one of them told me, they talked behind my back and decided where I should go, where I'd fit the best. And I can't complain. The vet that I worked for was awesome. She was a great businesswoman. Just built a brand new practice in a suburb northwest of Houston, down the street from the largest private pet store in Houston at the time. So, and of course, this was mid-90s. So the whole exotic thing was just booming. Reptiles was exponentially growing. Everybody selling baby birds. Everything was just going crazy at the time. So I hit it right at the top of the wave, and it was great. And I built that little pot, that tiny little pie to a pretty good size. And seeing one, maybe two cases a week to several a day.
Right.
I know it's great.
Yeah,
but,
that's awesome.
Private practice was good, but I felt like I could do more, and I wanted to practice at the top of medicine. I guess and I really wanted to push myself to be that veterinarian that could really have that capability of helping all the clients and all the patients rather. And I had a great skill set. I learned a lot. I mean, I went to all the exotics conferences. Of course, I was big into reptiles, so I always went to the reptile conference, and I just really wanted to expand more. So after a few years of applying, I went back to school and did an internship. This time I went up 35 to Kansas State University and did a 1-year rotating internship in exotics, zoo, and wildlife medicine. And it kind of encompassed all three disciplines, and it was just phenomenal. Pretty much just doing 100% exotics the whole time. And it was great. I loved it. And got a lot of great mentors from there, and it just elevated my skill sets exponentially. I got a ton of zoo experience. And of course, you're told as a veterinarian, young veterinarian, you can't get into zoos. Someone has to die before you can get into a zoo because it's that hard to get into. There's always so many slots open. I listened to that too, but as you could tell, I didn't listen. And I decided to go ahead.
Yeah.
And after my internship, I did a residency at the Oklahoma City Zoo. So I went back down I-35, and it was with Oklahoma State University. So it was kind of a joint residency. So I got a great deal of just zoo experience and some academic exotic stuff as well. Then in my second year, the San Antonio Zoo job came open. Which, I'm from West Texas originally. At the time we were dating, but my now wife's family was 4 hours one other way. So my family was 4 hours one way from San Antonio. Her family was 4 hours the other way. So we were right in the middle. And it actually worked out just perfect that I came down to San Antonio. So I was a senior staff veterinarian, which now the title's the senior director of veterinary care. Sounds cooler.
Yeah.
So it's great. And I've been here this month. It hits my 20-year anniversary mark here at the zoo.
Wow, that's amazing. So obviously it's been a good fit and you've enjoyed being there. So how different is the zoo setting compared to the clinic setting? You started doing these rotations in zoos. Was it kind of a culture shock, or, what are some of the differences?
Not really. The patients may have different names. They may have different rarities, being some endangered species. Obviously, believe it or not, and as an intern, I did see some private cats, either sanctuary cats and stuff. So I did see tigers and lions, bears, actually in a intern situation. Plus, they were tied to a couple different zoos. So actually, during my internship, I actually did large animal stuff. And on into the zoo, it just moving here, it just seemed to be a good fit, which was great. I did, do more hot stuff than I did before, because the zoos that you had interest in, at least in my internship, we didn't do a lot of hots. But as I did my residency, Oklahoma City Zoo had a hot collection, and San Antonio has a phenomenal collection of reptiles. And a good portion of that is a hot collection, and got a lot of experience, and it's been really good.
So what is this is probably too vague of a question, but a sort of an average day for you look like? I'm sure it's fairly dynamic, but what does your role look like?
Now as more the senior director, I have a couple of veterinarians under me. So my role now is a little bit more managerial, with budgets and staff and things like that. But in general, as a zoo veterinarian, what we do is we tend to round up first thing in the morning, check emails, make sure everything's going well. See if there's any new cases that came up overnight. Keepers will a lot of times will, at the end of the day, we all send out reports to all the different departments. So that way we can notify if such and such is off, or, just need something to take a look at, or they'll give us a call or that morning or later on that morning just to say, hey, can you look at this today? So we kind of go through, round up, kind of gather all those things. We kind of map out the day. Sometimes we'll have procedures scheduled. Like if we need to do a bear root canal, for example, we'll have that scheduled that morning. It's a little warm down here with 100-degree days. So, so unfortunately, if it's something that can wait till what we call winter, which is your summer, I think. We tend to move things to when it's a little cooler in the month, especially some of the bigger animals, just because the heat stress that could be potential. Or if we have to, we'll get up before the crack of dawn, and we'll start things at 6 o'clock in the morning if we need to, procedure-wise, and get it done before everybody gets to the zoo. And so we'll do those procedures in the morning. Then after we're done, after a few hours, we'll regroup, clean everything up, put everything away. The keepers have a break period, which is kind of a religion, that they have a break period, which is good for them. And after that, we'll a lot of times do some minor procedures or some quick rechecks. Then, of course, lunchtime, which is important. Then after lunch, we do the same thing. We'll do some minor procedures, rechecks, then finish out the afternoon. The techs will process the samples, do records, finish out the day, the last minute emergencies that may pop up right before closing. But that's kind of day in life. And that's just a typical day. No 2 days are ever the same. I will say that this is a great job for someone with ADHD, because it's never the same. And it could literally be all over the place, which is fun. I mean, that makes zoo medicine unique, is that, I could be working on a frog doing surgery, then turn around the next hour, I'm doing surgery on an elephant, or vice versa. So that's what's the cool thing about our profession, is that you have to be able to jump between these species, physiology, anatomy, just back and forth. It makes it fun. It's cool.
Well, partly it's kind of amazing that how frequently things need to get done, right? If you have such a high volume of animals, I'm sure there's always something that's, minor, at least minor procedures, but there must be a much higher diversity of animals that you have to become familiar with than being in a clinic setting. Your clinic, even if you're exotics, you still have sort of your top 10 list of most popular pet type thing. But in the zoo setting, that's quite a wide berth of different species and animals you have to work with.
Oh yeah, we make fun of human doctors because they're boring. They just have one species.
That's right. Yeah.
Your dog and cat client's got a couple. Large animal has a few more. Beyond that, I think as a zoo vet, I have about 65,000 species we have to cover, and that's not even invertebrates, because we do invertebrates too. You can probably increase that exponentially with all the inverts. So we don't have, but I'm trying to think how many species you have at the zoo. Probably 800 something different species. And that's just now. I mean, we've had hundreds of more over the years. So I've probably worked with several thousand species over my course of my career, which is fun.
Yeah, that's amazing.
And a part about my specialty is that knowing the differences. If a horse is vomiting, that horse is probably dying. It's bad. Horses don't vomit. We know that. If a rabbit is vomiting, it's also probably going to be dying, because it's also that bad. So I think a rabbit is a small horse, believe it or not. They both get colicky type stuff. They both have GI issues. They have long ears, so you can go that too. And they have the constantly growing teeth. So, I mean, there's you float bunny's teeth, just like you float horse's teeth.
Yeah.
I mean, there are some differences. I'm not going to say they're the same, but There's a lot of similarities, but that's part of our specialty. It's cool. And so we got to know what those similarities are. Ferrets, for example, are a lot of times they use those as research models for human vomiting because their stomach, upper GI has a very similar response to medications as ours does. So they use it for a lot of GI research. So, so I know the drugs that work for us work for them, and vice versa. So that's kind of cool.
Yeah,
knowing all these differences and things.
That's always the one area where you see keepers, get upset with vets is if you go to a vet who is trained in mammals, for example, like the difference in how these drugs interact in different body systems is kind of shocking, actually, considering like almost, you look at a biological system and you're like, okay, lungs, liver, stomach, intestines, things look similar just on a gross level. But the fact that, you put a medication in them and they can behave completely differently.
Oh yeah. And that's the tough part. Knowing about all these differences. One of the things I'm specialized in zoo medicine, and I guess I kind of forgot to mention that part that I am a zoo medicine specialist. And that exam is it's tough. I'm not gonna lie. It's really tough because just to pass the first day of the exam, you have 5 exams that you have to pass, each one individually. One's on marine mammal and fish. The other one's on avian. Then you have reptile. Then you have zoo/mammals cases, and you have wildlife. So I have to know all of wildlife medicine, all of zoo medicine with a mammal emphasis, all reptile medicine, all avian medicine, and all aquatic medicine. I have to know all 5 of those specialties and pass all 5 of those to get to the second day. And the second day, you take one of those, and then you take a whole day just on one of those sections. So
wow.
Now, at the time, there was a reptile day 2, and that's what I took. Now it's combined into a zoo companion animal, which combines all the avian and reptile and the small pet mammals. So they kind of combine that together now. But back then, I did the reptile one. That was basically a whole day just reptile medicine.
Wow.
In a pretty harsh sense.
Yeah, I can imagine how difficult it is. Do you have a favorite group of species that maybe reptiles are in there, but is there specific species that you like to work with at the zoo?
I'm a reptile guy. Absolutely a reptile guy. Which was really hard trying to apply to these internships way back during my career because all the stuff I did, all the talks I gave was very reptile based and very reptile centric. Chameleons if you want to get to my subspecialty, but yeah, reptiles are my thing. And I'm also boarded in reptile medicine and reptile practice, which I think you guys talked about a little bit before on previous episodes. But there is a American Board of Veterinary Practitioners, which is an organization that allows specialization in the private practice route where a normal practitioner can specialize in something. And that's great. So, these dairy cattle vets can specialize in dairy cattle or farm animals, feline medicine. In the case of exotics, we're looking at avian medicine, reptile and amphibian medicine, and pocket pet medicine, also called exotic companion mammal. So you can actually specialize in those. And I was one of the first 5 diplomates in 2010 in that reptile and amphibian practice. So
wow,
that's my focus.
Yeah. So reptiles all the way then.
Yeah, I have to do rabbits. I have to do birds. I have to do elephants. So I do everything. Just that extra, I have a passion for all exotics, but I have the extra love, passion for the reptiles. You can imagine.
So tell me a little bit about working with HOTS, because that's always a question. That adds a layer of complexity to just dealing with basic care or basic procedures. So what types of animals are you working with, and what sort of things are you having to do with them on a monthly basis type thing?
Sure. The nice thing about being in San Antonio is that the San Antonio reptile collection has a lot of history and has decades and decades of history of having a large reptile collection that has been pretty advanced, if you will. Joseph Laszlo is one of the curators that really brought to the idea things such as light cycles, temperature cycles, and this is we're talking back in the 70s and 80s when people were just throwing reptiles in cages, and they may or may not breed, but he was looking at nature and looking at things, how nature can affect breeding, and all that set up an excellent breeding situation where San Antonio's had a long history of having successful breeding of a lot of different species. Now, fast forward that till the 90s and 2000s, and today our department's kept up with that. And we have, I mean, I don't know, I'm sure the exact census, but it was like 700-800 reptiles and amphibian. We have quite a bit of reptiles in the collection. And our conservation department also it's relatively new, but over the last several years, we actually have a phenomenal biologist who is in charge of the program. That we have a former Texas State herpetologist who's the director. So we have a lot of reptile experience even within our conservation program. And it's, I'm not gonna lie, it's a little reptile, amphibian, fish based. So that's kind of nice having that program as well. So, I mean, I don't know the census, but it's probably well over 1,000 reptile, amphibian if we're at all the different species that we have and stuff. So, and a large portion of that is the hot species. And one of the things that we're known for is Mexican herpetofauna. Alan Carden, our VP, who was the director of the reptile department, used to go down to Mexico, work a lot with universities down there, and do a lot of collecting, a lot of field work. And our current ectotherm director does that as well. So we have a lot of that background in conservation medicine, and we have bred quite a few species. So you can imagine we have a lot of hot correlids and vipers in our collection, which is just fun. I mean, I've enjoyed that part. The reason why I go into all the history is because we've been able to hire some phenomenal individuals to be in that department. And I have to put my life in those individuals' hands.
Right.
And I absolutely trust those guys because they go through a pretty rigorous training to be able to be hot certified within the department. And they're good. And I have to trust them. And I do absolutely trust them. I mean, I've had hot training on my own, but they're the ones that take care of everything. They're the ones that do all the tubing, the hooking, the manipulation, and I do exams.
Yeah. So they basically secure the animal for you, and then you can, because obviously if, you can't tube something and then also do an exam, you can't do two things at once when you're working with a hot snake. So they have it secured and then you're able to do your work and just leave the head alone type thing.
Yeah. I mean, they're in the tube. There are so many things you can do when they're in the tube, believe it or not. You can kind of switch them down a little bit towards the end. I have the laparoscopic instruments I use a lot for humans and veterinary medicine as well. I'll use those. I use little graspers. I'll open their mouth. I can use forceps to open their mouth. I can go in, use clear tubes so you can look in the side, look at their eyes. Sometimes if they're close enough, you can actually stick a scope down in there and take a look. I can use scissors. I can use a little, almost like a needle on the end of a forceps. I can use that to open up a little abscess, like a pit abscess, for example. I can open it up, take a culture swab, take a culture of that abscess. Well, you can actually do quite a few things. I have, utilize the tube for scoping. We sedate them, we intubate them. Sometimes we'll keep them in the tube, sometimes we'll take them out depending on the situation, how big they are. But we'll do scoping, either upper or lower GI if we need to. X-rays, which in the tube is pretty easy. So you have them in the tube, you just take an X-ray, you turn it 9 degrees, take the other X-ray, slide it down, just do that back and forth, and it makes it pretty easy.
Yeah, that is fascinating. And that's kind of one of the, I guess, maybe ethical issues about the venomous snakes being in the private sectors, because, there's so few vets that can actually are comfortable seeing that. I mean, I wouldn't expect almost any vet to have the confidence or the comfort or the training to just, do a checkup on a venomous snake, for example.
I see very few in private practice because I'll do some work on the side, or I have some friends that I've known and colleagues for many years that do have a hot collection. So I'll consult with them or sometimes we'll go out and see their stuff. But you're right, there's not a whole lot. I'm one of the 2 or 3 in the state that may see them. There's only a few people that will actually see them in the state. And I'm one of the few that will do it because you're right. No one wants to mess with it, and for good reason.
Of course, yeah.
I mean, it's a life and death in some of these guys. Just because the zoo has a repository or there's a anti-venom network poison control, that doesn't mean you're going to live. It doesn't mean you're going to get what you need.
Exactly.
Because you could follow the news and there's always someone on a regular basis getting tagged by a hot. And a lot of times it's the zoos that have to step up and save this individual. Yeah. And that's taken from our stocks sometimes. And, with COVID, it's been a little challenging sometimes to get some of the antivenom because of shipping and just general availability sometimes.
So in general, do you guys have a pretty well-stocked, sort of primed anti-venom, cache ready to go if any accidents happen?
Absolutely. Like I said, we're on the antivenom database that they keep in a national level. So that way all the zoos, participate in that, and that helps. But again, there's no guarantee that might be available to you locally, depending upon what you have versus that. So yes, it's there, but don't bank on it because it may not be available at that time. And there may be other logistics involved. All this is well known within the hawk community because they talk about it all the time. Mm-hmm. And I hear people talking about it and it's like, yeah, but
yeah.
And
we have necessarily count on it.
Yeah. And we have a hot show in Texas. That's I think next weekend or the weekend after next that actually they do sell hots there. So, anywhere from gaboon vipers to mambas to all the crowlids, different pit vipers. Some of the vendors are good. They're pretty selective and they're not selling it to a 6-year-old, but they're available.
Yeah.
Texas has a pretty liberal set of laws when it comes to hots. So there are a lot of hot snakes in Texas in the private sector.
That's interesting. I would never have it would never have crossed my mind that would even be a possibility to have a show with hots sitting on the table. But I guess, like you said, there's looser rules or looser regulations and laws in Texas. That would never happen where I am, but it's but at the same time, it's not like you have a crazy mass amount of accidents and incidents, or maybe they get swept under the rug, but it's not like a Rolodex of accidents that are happening in Texas. So obviously the sellers are doing a good job making sure they're going to the right people.
I hope so. Definitely, yeah. I hope so. Yeah. But you're right. With the amount of reptiles I see go through that place, I would expect a lot more. Mm. But thank God we don't have a lot more of those bites out there. And a lot of the guys that are vendors, they're pretty good. I can't say that for everybody because I don't know all of them. But some of the ones I know, they're pretty picky about who they sell to. And they sell a lot of times to the same people, the same other breeders and things like that.
Yeah. I wanted to spend a few minutes discussing quarantine. I had a listener reach out to me and talk about quarantine. Clearly, that's a pretty important piece of private keeping that we talk about all the time. Is if you're bringing a new animal into your collection and how to making sure that animal is quarantined away from everything else. But it's also one of those things that people just kind of say and we never actually explain how important it is and how to actually practically do it and what to look for. And I assume that in the zoo setting, quarantine must be a huge part of the collection, and so it's probably on steroids compared to what we have to do at home. So maybe you could just talk through what are some things that keepers should be doing in quarantine and how to do it properly.
Sure. Quarantine itself is no different than zoos, pet stores, private practice. You have to isolate the animal from everything else. Mm-hmm. I know it sounds so simple and basic, but it actually is kind of hard sometimes. But in a private home, a separate room, a separate area, garage versus another bedroom or something separate, completely separate. Ideally separate air handling, but that's not always practical. Because for a private house, you have one central air conditioner heating unit. So that can be difficult, but it's not in practicality, it's just somewhere separate. That's it. I know it seems crazy, and we do the same thing. We have a completely separate area that's not even a part of the collection. That room is completely isolated. It's in a different part of the zoo. And that's only for reptiles that are in quarantine.
So you have a bunch of different reptiles in that area that are currently in quarantine.
Correct. And a lot of times we do all in, all out. So we try to plan for all the animals coming in during a set period of time. And once all the animals in, we start the clock. And we go from 60 to 90 days, depending upon a couple different factors. Sometimes snakes take longer to do things. Sometimes tortoises as well. So a lot of times we'll get that 2 to 3 month period in there, and that's minimal. And that's barring no complications during quarantine. We can extend that a lot longer if we need to. But as long as during that period, everything's separate, we try to recommend taking care of them at the end of the day. Take care of your regular animals first, always. then deal with quarantine at the end of the day. So that way you're not doing it backwards and contamination wise. Now, quarantine's a two-way street too. And most people kind of forget that you're quarantining this new animal away from the collection, but you also have to quarantine your collection away from the new animal, because you could have something in your collection that you can give this new animal. Things like for amphibians, chytrid, for example. I've seen some asymptomatic chytrid situations. Then you bring a new animal in, and it's been naive to that.
Right.
So, and it may be two different species too. You got to keep that in mind. So, same thing with things like mycoplasma and tortoises. You could have a mycoplasma that's non-clinical in your personal collection. Then you bring this animal in that may be naive to that mycoplasma, and it could be exposed to that. It may be negative coming into quarantine, which is great, but you got to know what's in your collection first to be able to figure out what you're bringing in or not bringing in in that case. So you have to kind of sort of make sure you keep that separate, not in a separate cage in the same room, preferably a different room.
And then are you guys then disease screening, I guess, really on both ends? You need to know your collection is clean, like you were saying, and then are you running pretty common tests for animals that are in quarantine for reptiles?
Yeah, absolutely. I'll use chytrid, for example, because that's one of the ones that most people are familiar with. And a lot of shipments between zoos and collections, we do tests for chytrid on both sides a lot of times. Back when the chytrid became the foremost on the press, that was one of the things that we're like, oh, so all these zoos are bringing in these rescue collections and things like that. So we had to test our collection to make sure we were clear or not. So we also have to test our stuff. Same thing with, like, I use mycoplasma tortoises, for example. We have to test all of our animals that we have, see they're all mycoplasma negative, which we know that we're mycoplasma negative. So if anything comes like quarantine positive, then we got to reject that animal from quarantine and send it back, right, or find an alternate place. So we do things like that. We test, we do fecal exams for parasites, even though most of the stuff is captive, they still have some parasite stuff. Not all parasites are bad. Things like pinworms and some of your herbivore reptiles are okay at low numbers. We know we're never going to get rid of those completely. Like bearded dragons, you're never going to get rid of those oxyurids out of there. But as long as the numbers are low and manageable, that's fine. But we know things like coccidia, which is not unusual to find in captive species, because it's such an easy spread. We know we need to treat some of those. Now, there's some species, like some of your leaf-tailed geckos, it's almost impossible to clear.
Really?
And that's something that I've talked to a lot of different places. Even on the zoo world, it's almost impossible to clear those. But you want to look at those animals still, even though they have it. You want to make sure the numbers are low, because that's coccidia is one of those that's a direct life cycle where they can pick up the parasite from the environment and reinfest themselves back to back. So you want to make sure that those numbers stay low. So if I have a leaf-tailed gecko that has diarrhea, for example, then I check it has a ton of coccidia. Yeah, I'll treat it to get the numbers down. And we'll do environmental hygiene and things on those lines. Unfortunately, when you get to that point, you're in a bioactive enclosure or a nicely decorated enclosure, you also have to strip that down and clean that as well, because that environment's full of the coccidia. So that can be challenging. So we do test those on periodically just for that reason, to try to pick up those parasites that are normal. And in quarantine, snakes, they don't always poop on schedule.
Yeah.
So it can be a little tough sometimes. So sometimes we'll have to make some accommodations for their defecation cycles, but we do definitely check fecals. And I forgot to mention too, a lot of times we ask for free shipment stuff for zoos. So the zoos will do some of the shipment on their testing on their end too. So they already have some tests. Then when we get them, we repeat some of those tests as well. So I forgot to mention that. Sometimes we double dip a little bit on the testing.
Yeah, okay, that makes sense.
Because of stress of shipping, for example. As a prime example, anything that mycoplasma, some of the viral stuff, herpes virus, all that may come out with that stress of being shipped. The dehydration is associated with that, the cortisol steroid release that is released in the body that might suppress the immune system. Some of these secondary things might just pop up.
Mm-hmm. Interesting. So it just shows that it is a simple process. Keep them separated, run through some tests, make sure your actual own collection is clean as well. But I find that leaf-tail gecko thing interesting. So people who keep leaf-tail geckos, so is that something that they should do on a regular basis? Is just get the fecal done, or is that, or or do they wait till there's diarrhea involved before they go get that checked out, or because it's always present that should be a cycle?
I would do a periodic cycling every 6 months, every 3 months, depending upon the situation. If you have some that are chronically having issues with either not gaining weight, if you're having lack of reproduction, that could be a subclinical thing that's causing nutrient loss. So that may affect reproduction. So people forget about that, is that sometimes that could also affect breeding situations. Anytime that loose stools or anything abnormal, I would definitely have a fecal checked. And if you have high numbers, then you have multiple animals, you get them individually checked if you can, and try to track those individually and see where the problems lie. You could have one that's super high and shedding it to everybody else, then they're getting high secondary. So you just want to track them over time. Yeah, it's an expense. And I'm not going to lie. I mean, I understand that, as a breeder and as a owner and veterinarian, I understand that, there's expenses involved in these situations. And yeah, fecals aren't cheap. But sometimes you just got to run them just to know what you're doing. Cause you can just have that animal that you're spending all this time and money trying to get it to breed and never bred because it's clinically sick or subclinically sick and not having the nutrients it needs.
Right. Yeah. And you could be changing all these other things, changing the light, changing the environment, and you're never going to get on top of it because it's loaded with parasites you don't even realize.
Yep.
So what do you keep? You have some reptiles at home that you keep that are separate from, your job. Do you have currently keeping reptiles?
When I was when I said earlier, I've had a couple hundred reptiles before, plus. That part of the early phase of that reptile keeping, when you start adding things on because they're cool, I've already done that.
Yeah.
I beat that part of the bug. And over the years I've had things come and go over the years, but I still have the animals I really like the most. Even though I'm kind of known for, because I write a lot about chameleons and talk about chameleon medicine, I actually don't own any right now. I've had off and on over the years, I've had chameleons for almost 30 years now. But I've always kept up with the husbandry and discussions, and I've talked to Bill Strand at the Chameleon Academy podcast and know him off and on over the years, and of course locally talking to everybody here. But I can't remember how many different species I've had over the years. It's probably a couple hundred. But right now I've kind of concentrated on just some of the small stuff. I have younger kids, so giant pythons aren't necessarily the fun stuff for them. So I have my rosy boas, my sand boas. I breed them, and they're fun. I think they're great little beginner, easy snakes to work with. I have one female anthill python, Antrasia pertiensis, because I love Antrasia. I've bred spotteds and children's, and if I can ever find a male for my female, I'll try to breed anthill pythons. Even though I know they're quite difficult to get the hatchlings to be fed, so I'll have to get used to doing tail feedings and stuff. Yeah. But someday I'll get a male to attach to that program. And I'm a sucker for redfoot tortoises too. I've always had redfoot tortoises. I think I've had this pair for good 10 years now. And, I have a pen for them in the backyard and stuff, and they bring them in the few months of the winter when it gets too cold. But they do well. I've actually adopted one, and I could probably even add a picture or email you a picture or two of it. Sure. But it was one that it was a client surrender because of the cost it was going to take to treat. It was a hit by car that a couple months ago I did surgery to try to repair, but unfortunately it was pretty bad. From all the way from the bridge all the way across midline to the other side of the shell was fractured. Wow. So it was a pretty bad break. Screws, wires, and things like that to try to reattach everything and try to get as close as I could back to a normal position, knowing that I couldn't quite get it back there because I don't know how long that fracture's been there. It was old when I got it, like at least days to weeks old. Mm-hmm. It came back a month later for follow-up. and it was smelly, pretty bad. So I did a debridement, and you can probably look at the picture over here. But I had to take a lot of bone off, and there's a pretty large. I try to think how 40, 50 square centimeter worth of shell missing.
Wow.
On a red foot that's about yay big. So pretty bad. So I luckily have a lot of shell experience, you can imagine, over the years. And I do one of the vacuum assisted closure, which is the wound vac or vacuum bandage type therapy. It's something I've been doing off and on for almost 20 years now. And it's a really cool therapy in humans where you put a wound under vacuum and use a specialized vacuum pump and bandages. So I'm treating her now with that. And like I said, I'll send some pictures so you can show.
Yeah, that'd be great.
Some are pretty graphic, but it's really cool. We've actually had some pretty good breakthroughs in the last few weeks. Her spine is damaged because of the fracture, and there's no shell over that part or section of her spine. So finally, after I think it was week before last, I was doing the little butt scratch thing where you scratch from the back of the shell and they do the little butt scratch dance.
Yeah.
And she did it for the first time ever. And I was like yelling, dragging everybody to see, because I was like, oh my God, she's actually physically standing up, because she won't use her back legs when she walks.
Okay.
Forgot to mention that. So she actually stood up on her back end and did a little shimmy dance. And I'm like, this is awesome. It's not, I can't say the spine is completely intact, but at least she has some function back there.
Like up until that point, were you thinking she's paralyzed for sure with the bottom legs or back legs?
Well, she would tuck in her back legs. Because sometimes when they're paralyzed, their back legs just flop out, but she keeps them tucked in pretty tight. And even this past week, after I got back from ExoticsCon, I noticed that her legs are a little more relaxed. So they were not tucked up all the way in. They're a little more relaxed. Of course, she's still doing the butt dance, which is great. Then I noticed that when I set her on the ground, I do the butt dance and she starts to walk a little bit. She actually starts to slowly use her back legs. Now, there's a condition where it's called spinal walking, where you could sever spinal cords and the back leg can kind of sort of work inherently. So I'm hoping it's a little bit more just that, and it actually is maybe some actual nerve function. So fingers crossed, big time. So I'm really, really encouraged. She has not really eaten for me a lot, unfortunately, because her GI tract was full. From pretty much from her stomach all the way to her colon was just impacted with food. Wow. And some of that could be just because of just the paralysis part of the gut. So we've been doing enemas, gavage, tooth feeding with Oxbow Critical Care, the herbivore formula. So I've been doing a lot of that for the last couple of weeks. And I think we finally got most of the stuff starting to pass through. But my wife fed her a couple of days ago. I had her outside. I was sitting on the chair, had her in the front yard. She was just cruising around. And I gave her like a little tray, like the McDonald's serving tray. Yeah. Set her in there, filled it with water. She was drinking out of there. And then my wife gave her some food. She started eating a little bit. And I was like, wow, awesome. She's eating. Cool. And then just a few minutes ago, my daughter was like, she's eating. And so she gave her a bunch of food and she's eating much better.
Oh,
so
wow.
Fingers crossed that we finally got that next hurdle. So the shell is going to take a while to heal. It's going to take anywhere 6 to 12 months probably to heal. Doing aggressive therapies such as this. I've had to go back a couple times to remove more dead bone and shell in there, but luckily she has a membrane that separated her lungs from her bone, from the inside of the shell, the carapace. So I know that membrane there is going to be what's eventually going to heal and attach back to the carapace, and that's where the bone interface is going to happen. It's really cool. What happens is when the shell starts growing in, the keratin comes in first. And the keratin kind of starts, it's almost like think of like a mold type growing on a surface. The keratin slowly kind of starts to eke into that tissue, that scar tissue, if you will, that pink tissue. It'll slowly start coming in, and then the bone's going to start following that. It's really cool. I've had a couple of cases where I've been able to track with pictures over time, and it's a really cool healing process, and it works. The wound vac actually really accelerates things. I had one Aldabra case, which was my index case that I published years ago, where It was a good, about yay big wound on a dauber tortoise that was full thickness, and we did it in 6 months. And literature wise, they always say 2 to 3 years with a old fashioned epoxy patch over the top. But we did the wound back where we changed bandages twice a week, and eventually it healed super
So
fast.
is that just because it keeps it cleaner? It's just pulling everything out, and the site is way cleaner. That's is that really the only difference?
There's two factors. One, it puts everything under pressure, so it pulls in all the extra fluid. Because as you imagine, if you get a cut on your finger, and what happens if you get your finger wet with that cut? It swells up and it breaks open that cut a little bit, and it heals longer. And that's called maceration, medical term. That's just too much fluid, edema in that area, and that inhibits healing. So what the wound vac does, it sucks away all the fluid, the excess fluid that is, and with getting rid of all the excess fluid, it's going to bring in capillaries. What do capillaries bring in? Blood cells. Those blood cells are going to bring in healing factors. The white blood cells are going to get rid of the bad stuff. Red blood cells are going to bring in oxygen. So all the things that we know about wound healing that's positive, it's going to enhance all that. Then there's a secondary factor. It's a micro stretch factor. It has to do with the foam, where it actually when it sucks up onto the healthy granulation tissue, it actually micro stretches those areas. So it stimulates collagen deposition. So it's going to stimulate the underlying healing to allow everything to kind of heal over.
Wow.
I know, it's just crazy. It's a crazy cool stuff.
Yeah, that's really amazing. Now, let's just say an example of somebody who has an animal at home who has a wound and they don't have the opportunity to do the vac bandage. What are some things they can do to help accelerate the healing process and make sure that does it, happens properly? Oh
yeah, I mean, I'm one of the few veterinarians in the country that do the wound vac. So unfortunately, it's not that common, and the expense wise it's up there. I'm not gonna lie, it's up there. I have being a veterinarian, I can make it work a little bit easier in that sense. But, work with your local vet, and we could talk a little bit about vet stuff, but, find a vet, work with local vet. There's ways to do that. There's ways to use gauze in the wound. You got to cover that wound, culture the wound if it doesn't heal or has problems healing or it smells bad, because we got to get that bacteria under control. And there's a lot of resistant bacteria out there. So we need to make sure we're using the right antibiotic. Get in there, clean the wound out, take away all the dead tissue, cover the wound with healthy, sterile gauze, and change that bandage on a regular basis. Get the animal on antibiotics. Just same thing with us. Same exact principles apply. Just reptiles do it, 10 times longer. Sometimes, especially tortoises, they take forever to heal. And that's where we have to talk to the owners and let them know that, we're talking months. An iguana or a snake, we're still talking months.
Yeah.
6 to 8 weeks on a big wound or incision, or at least in snakes, I always say 2 sheds.
Yeah.
Typically after 2 sheds, most of these incisions or wounds are healed for the most part, unless it's something very complex or extensive. For tortoises, the skin part, a couple months. But when you're talking about shell growth, we're going into 6 months. They go years potentially. The tortoise I did, I'm 6 to 12 months on just the wound that I have open. There's more wound there that I haven't even opened yet.
Wow.
There's part of a fracture line that's on the upper left side and along the bridge is fractured. Now, those cases, I ended up having to cover that initially because I was sitting at home with the owner, and that's the part that's going to be in the dirt. So I cleaned that the best I could, and I did have to epoxy those sections over. But doing that is a catch-22. I'm covering an infection. I'm covering that wound. So I could be setting me up for failure, but I'm hoping keeping the majority part of the wound healthy and letting that heal and keeping the animal healthy, that the immune system is going to work with me instead of against me and wall off that infection. So when it comes time to the main wound is getting close to or well in an established way of healing, then I can go back and start opening up those other areas and debride away that dead bone. And sometimes, if nature works with me, there will be a nice line of healthy bone underneath, and all that dead tissue on top, I just chip away the dead tissue, and there's healthy scar tissue underneath.
Wow.
And that sometimes nature works with us in that case. So that's what I'm hoping for.
It's incredible the just rejuvenation power of life,
Mm-hmm.
of biology, and especially when you can
Oh
actually
yeah.
see it, when you're actually looking at the scar tissue regrow or these tissues creep into those areas. When you're not a vet or a doctor, you don't necessarily see that besides seeing like a cut heal and whatnot. But it's truly amazing how that happens and how the body just goes whoop, heals everything back up, even when they're in such horrible states.
Yeah, you gotta work on the main part of the body. You got to work on the basics of getting calories in, getting fluids in. When we're sick, as well, especially reptiles, they're worse when it comes to negative energy balance. We're always eating. When they're eating, it's positive energy. We're putting positive calories in, body's utilizing it, and pooping out the rest. In a negative energy balance, they're not eating. They're utilizing their muscles, their fats, all the other nutrients in their body, stealing calcium from their bones, for example. They're stealing all that in a negative state because they're stealing from their body to maintain themselves. We have to correct that. And if we could turn around and flip that with tube feeding, supportive care, fluid therapy, we can flip that equation back to a positive state. Then that way the body will start adding muscle, start adding more fat stores and nutrients, and that'll switch the immune system to a better functioning state.
Mm-hmm. Are there things that you see keepers do or don't do that you wish they would implement on a more regular basis? I mean, obviously, the obvious is like checkups, take your animals to the vet, but are there things that just jump out that you go, oh, I hate seeing that?
Let's go down this topic. Let's go down the topic of veterinarians hate reptile owners hate veterinarians.
Yeah.
I think that's kind of the basic topic we're cutting on here.
Yeah.
I will be the first to admit veterinarians are a pain in the ass. I'll be the first to admit that. And when it comes, especially in reptile medicine, since I kind of been I'm on both sides. So I worked in the pet store. I'm a veterinarian. I kind of had both parts of the equation over the years, and I understand all the different sides of the story. What I think a lot of veterinarians did I think in the 90s, a lot of this started, is that all the reptile craze was hitting. All this stuff was being imported in by the containerfuls. I mean, it's just so much was being imported in at the time. And people were trying to sometimes seek out veterinary advice, but there weren't a lot of experienced vets out there at the time. Mm-hmm. No one knew what to do with stuff. Back in the day, everyone was recommending dog food for iguanas. And there was some veterinary literature out there that said that. And there were veterinarians that were recommending that because that's what was recommended at the time. And we now know better that things don't always work over time because we learn. So I think a lot of that happened is that a lot of reptile people went to veterinarians who didn't know what they're doing. And sometimes, as veterinarians, we can tend to be overconfident. There's a fine line between arrogance, overconfidence, and just being real. Mm-hmm. Sometimes, and it kind of can be blurred a little bit. And I can't say that all my colleagues have been forefront with their experience. And I hate to say that about some of my colleagues over the years, but I've seen it. I'm not the world's best veterinarian in the world, but I do my damn best to try. Mm-hmm. And I'll be the first to admit when it's something I've not seen or never done, or, I've seen like once a long time ago. I'll be the first to admit it, and I'll work with you. And that's, fortunately, most veterinarians don't like the work with you part. So I think that was a lot of it, is that people were trying to get, these early years, trying to get the veterinarians to help them out. And they were given wrong stuff, wrong information, because the veterinarians just didn't know. They were trying to figure it out, but yet the select few veterinarians, the more my reptile kindred veterinarians, the reptiles, Associated Reptile and Amphibian Veterinarians, mm-hmm. that group that we've all kind of been around since the beginning. I think a lot of us understood that at the beginning. We understood how to work with the individuals, how to work with the breeders, how to work with that. But not all veterinarians are like that. So I think that's part of where the bad rap came from. Mm-hmm. And two, I think some of it came from the converse side of it. Some of the embittered reptile owners distrusted veterinarians. So they went their own route. They bought books and they And yes, you could buy medications over the not legally over the counter, but you can buy it. You can buy stuff that's not approved for the United States. You can just web searching, and it's crazy what you could find, and at-home treatments that are out there. I mean, Dr. Google is real.
Yeah.
So from that standpoint, they do their own treatments. I mean, I can't fault them for that, but sometimes I wish they would work with us more, try to close that divide a little bit, because I understand you guys don't have a veterinarian you trust, and that's okay. But what a lot of times I'll do, and what I try to tell people that I've worked with over the years, is try to find the veterinarian that you trust. If it's the next town over, or it's in your same town, it may not be the exotics veterinarian sometimes. Now, just don't find someone that'll just give you drugs for, just charge you, give you drugs without looking at the animal. I mean, you really need to find someone that really does care about the animal and want to work with you on that. But try to find the veterinarian that works with you and understands. And that's hard. That's really rare. As you probably know, it's really rare to find the veterinarians that will work with you instead of against you on that. So just call around. Even if you have to drive 2 hours. I mean, I have clients drive 3 and 4 hours to see me before in private practice, and it is what it is.
Yeah.
So just try to find that person that you feel comfortable with and they feel comfortable with you, and work with them. And I've had too many clients that fight me on stuff that they're like, no, I want to do it this way. It's like, no, I really think you should do it this way. And sometimes we're just at an impasse, and sometimes that may be on me and it may be on them. But a lot of times I go, okay, fine. Let's work together. Let's figure out why you want to do it this way and why I want to do it this way. Just like a reptile husbandry. There's so many different ways to do husbandry. Chameleons, for example, we got such awesome UV lights now. And we know if you have a super kick-ass UV light and you start giving a lot of vitamin D, something's going to go wrong.
Yeah.
If you start over supplementing UV and over supplementing vitamin D. So we know that, some breeders say you got to give this much and give vitamin D this much, or vitamin A and frogs and stuff. So we know that every breeder has a different setup.
Right.
And we have to be able to tease that out, because I've seen too many situations where they listen to this breeder for the supplements, but they listen to the other breeder for, like, say, the UV light, and it doesn't match. So we got to make sure we balance all that. So that's where I go to the individual and go, fine, let's figure out the treatment. What's going on? Maybe they like Baytril for some reason. Maybe they want cetazidine because that's what they have in their shelf type thing. So that's where we try to work with each other. And that's kind of where I'm kind of getting at, essentially, is rambling on. But I think we need to find that common ground a lot of times and really work with each other on that. And that's what I try to do with different breeders, and try to find what I can do to help them and facilitate the ways that when they do have something go bad, they'll come back.
Right. Well, and it seems like vets who are like yourself trained in specifically reptiles, for example, they're also hobbyists, right? Most of them are obsessed with reptiles as well. So they're basically just the equivalent of the rest of us who are keeping, but also a vet on top of it. We don't want to treat them as the regular vet who's just down the road who just looks at dogs, for example.
Exactly. I mean, unfortunately, there's just not a whole lot of us. There's only about 20 of us, give or take. And we've unfortunately have lost a couple individuals this last year that were reptile specialists. Unfortunately, cancer diagnosis sucks. And that was pretty sad, losing those individuals this last year, because they were extremely helpful in this reptile medicine community. But there are hopefully a lot more veterinarians that aren't specialists that do phenomenal with reptiles. And that's one of the things that I'll say, if you have a new owner with a reptile, find a veterinarian before you get a problem. That's the best thing.
Yeah.
Find it at the very beginning. Just if you get if you board get the reptile, it's even better. So that way you can kind of find someone. But even if you buy a brand new bearded dragon, find the people in your area that see bearded dragons. Hey, talk to them. Sometimes, with COVID, it kind of changed everything because veterinarians got extremely busy. But, not that COVID's over or anything, but you want to find that individual that's willing to work with you and that has the knowledge about bearded dragons. Is this, they see one bearded dragon every 2 months, or they see 2 or 3 a day, or 2 or 3 a week? Sometimes the one sees it 2 or 3 a day might be better just depends on what fits for you.
Mm-hmm.
Sometimes it's the personality. Sometimes it's just this person will listen to you, and just talk to them, interview them. Even if you're a dog cat owner, same exact thing. Find the veterinarian that is willing to work with you and one that you like.
Mm-hmm. Yeah, that makes a lot of sense. And you were also telling me when we were communicating through email that there's issues between relationships between vets and pet stores. And I'm outside of that bubble, so I'm not sure what that looks like. So can you tell me a little bit about the tension there?
It's about the same. It's the same thing.
Okay.
And the answers probably. It's, these big chain pet stores have a set protocol that they do in the store. They have the stuff on their shelves that they recommend, and they kind of are recommended to tell the owners to buy this, this, and this when you buy this. And we know some of those products are wrong or inferior to other methods. So some veterinarians look at it as oh my God, pet stores are just horrible. What the hell are they doing? And working in the pet store and working not just in a pet store, but with pet stores over the years, I've learned that sometimes that they're being told this, but if you can get in there and talk to those individuals, sometimes you can help make that difference. Now, the frustrating part is you get a new employee every 2 weeks sometimes. And the turnover is bad. And with COVID and everything else, I'm not gonna lie, it's been even more exponential. I have a big chain that's down the street from me I buy my crickets from. And, just the general dog food and supplies and stuff. So, I see them all the time. I know the store manager pretty well. He's a reptile guy, luckily. And he'll call me or talk to me, or he bring in animals when I'm doing my relief work on one of the clinics they work with. So I see him all the time, talk to him, and we've had candid conversations about this difference. And a lot of veterans just don't want to deal with pet stores, and they're limited on funds. I mean, in some ways, it's cheaper just to let a bearded dragon die, than take it to the vet. And that's the pet store mentality. So now it's gotten better. I will say, some of these big chain stores have hired veterinarians as consultants and has really tried to elevate that game, try to elevate the stuff they carry, stuff that the supplies they use. So it's gotten better over the years, but we're not there yet. We're getting there.
Yeah.
But a lot of them would rather just throw their dragon in the freezer, which is inhumane, one, than treat it. So that's where just going in and talking to them really helps. And that's how I started my career. And that's how I built my practice in the 90s. Is I went to every single pet store in the area on my day off. I had Tuesdays off. It was kind of weird. Day off, be off on Tuesdays. I literally went to every pet store in the area and said, hey, here's who I am. They get to know me. Can I help? And what can I do for you? And I did a lot of stuff on my own, helping them out, talking to them, learning what they're doing. So it educated me, but also in the flip side, helped them as well. So it was kind of a two-way street and stuff. And I said the largest private pet store down the street from me had their vets and had their protocols and stuff. And it took me a year of talking to them and getting to know them that they finally trusted what I was saying. And then they sent all the clients to me, majority that lived in our area, obviously. And I saw their animals and took care of their stuff. So I think working with them and trying to really cultivate that relationship will help both ways. It'll educate the veterinarian on husbandry, because I think that's still one of the areas that the reptile and amphibian specialists, like you mentioned, we know the husbandry because we live it at home.
Exactly.
A lot of times. But a lot of veterinarians just don't have that many reptiles at home.
And
there's nothing wrong.
Yeah,
there's nothing wrong with that. Mm-hmm. But you have to be open to listening to the owner to learn about the husbandry. And husbandry changes. We know that too. I've been going back, listening to all these different podcasts and different things. Through the cast, listening to all the frog stuff that, I've had frogs before, but I haven't had frogs in years. So I think my kids want to get new frogs. So I'm kind of listening to that, trying to elevate my husbandry knowledge and going back. And that's not your typical veterinarian that's going to want to do that. I read textbooks too, but I also like to listen to the people that are raising these animals and really getting a feel for the nuances.
Yeah.
You know, the chameleon stuff, we used to put misters on, the spray misters and stuff just on for hours a day, sometimes back when, the 90s and stuff, because that was the standard of care. Screen cages, misters for a long time, keeping them warm, like really warm. And now a lot of that's changed where, we should be cooking veiled chameleons as much. We need to probably knock them down a little bit more in the temperature range. We're talking about fogging in the evenings, not misting.
Mm-hmm.
So the fogging is raising the humidity that way as a safer means and as more of a natural means. So those types of husbandry changes, even some of my colleagues probably don't know all those nuances. And I've given lectures the last couple of years talking about some of these changes in husbandry, about things we knew that we don't know that are changed.
Right.
So, I talk about that, and I think I'm going to give another lecture like that next year at a conference, talking about some of the practices that we do. It's just not the same anymore. And
well,
I had
it's funny because you like you think what we're doing now is the correct thing because it's what we're currently doing, right? So it's sort of like that sort of logical fallacy of just doing something in the present seems correct, but that's why we have to stay open and communicate because, like you said, there has been a crazy amount of changes over the years, and there will continue to be.
Absolutely. I mean, enrichment and training has just gone a lot more. Even within the 5 years, it's gone even more. But even in the last 10 to 20 years, in the 90s, we weren't talking about enrichment training for reptiles.
Mm-hmm.
This wasn't a thing. They were just now they were barely talking about for zoo and mammals. I mean, it's always been around, but that was getting to be more of a forefront. And then birds, we're talking about doing training for birds in the 90s and 2000s. And now reptiles are like, oh, yeah, we should probably do them too.
Yeah.
And you've had people on for that. And I've listened to some of their videos and podcasts. And it's really interesting how all this is catching up. And we're learning more and more. And I think it's going to change.
Yeah. Yeah, it'll continue.
We're not feeding dog food to iguanas anymore. Thank God for that.
Yeah. We've surpassed that. And one other area that of your resume that sort of fits into this sort of advancing what we're doing on the vet med side is the acupuncture work that you do, which I found pretty interesting. Like I've not heard of. I had a physiotherapist on about a year ago, and I forget if he talked about acupuncture, but he just talked about physiotherapy in general, which was to me sort of a newer concept for in the vet med side, which to me makes perfect sense. Being a former athlete, how important that is to keep animals healthy. But can you talk a little bit about the acupuncture and how that's is that something that's relatively new, or how does that work?
Reptile acupuncture, again, is even newer than even dog and cats. There's not a whole lot of us that do it, but there more and more people are getting more experience with it. Looking at human acupuncture has been around for a long time, thousands and thousands of years.
Yeah.
Then the animal acupuncture, Chinese medicine side has been around for quite a while, but it was more in the realm of horses, pigs, chickens, those animals that were either food animals or work animals.
Mm-hmm.
We actually have some of that knowledge from thousands of years old, believe it or not. Now, fast forward to you start getting to the veterinary side of things, and we started picking up more for dogs and cats. And on the human side, interest in these alternative medicine, these different modalities of therapies are becoming more at the forefront. And then veterinarians picked up on that, and we've been doing dog and cat acupuncture for quite a few decades, and now we're applying it to exotics because that just seems to be the next transition. So there's not a whole lot out there. There's a few things out there. One of my colleagues and I, she's has a book chapter in one of the acupuncture books has a chapter on reptiles. She published that. Her did a wet lab a few years ago that was pretty well attended. And I think we need to do that again, probably here coming up. Just kind of introducing people to it. Just kind of, the concept of you could do acupuncture in these different animals. Now, I was always interested in it because I like to think outside the box with my zoo medicine too, because I want to have all the tools available to be able to help my patients. And I've gone, like the wound vac was a brand new therapy that wasn't really used in the animals at the time. doing some of the different ointments and wound management stuff that I've done over the years. They're all human products that I've extrapolated over.
Mm-hmm.
So to me, acupuncture was just the next combination. And eventually the course ended up being in San Antonio that year. So I ended up doing the acupuncture course here in San Antonio, which saved travel quite a bit. And the zoo helped me pay for that as well. And we had our Komodo dragon male, who he's in his early 20s at the time, pretty bad arthritis. And I put him on anti-inflammatories. We've done some other things. He just never really responded well to the anti-inflammatories. And I used what I thought was a fairly good dose. I didn't want to go up higher because bigger, just metabolic scaling type things. I didn't want to overdo and hurt his kidneys and things like that. So at the time, I just started an acupuncture course and, talked to instructors, and we came up with a treatment plan. And I did it on our big Komodo male, which he's just a big baby. Believe it or not, it's like a puppy dog, which, not trying to anthropomorphize, but he is pretty mild-mannered. He tolerated extremely well. So, I did the first session, and within a day, he started walking better. And this was a dragon we were talking about quality of life and possible euthanasia on, to starting to walk better and improve after the first session.
Wow.
So we repeated again the next week. We did like 3 or 4 weeks in a row, then every other week and once a month. Pretty much treated him through maybe about 8 treatments over the course of several months. And he got back to what, quote, normal for someone who's got severe arthritis. And we did x-rays and workup, and had extremely bad arthritis. The joints they want to make you cry, arthritis. I mean, they were pretty bad. And one of the things I've always said, treating him is I can't fix him, but I can sure the hell try to make him live with him. And that was my goal, was help him live with those knees and elbows too, and try to help him out. So we did. I actually counted this up for talk I gave, and we did 30 acupuncture sessions over the course of almost 8 years.
Wow.
And during those 8 years, he had his up and downs, but we were able to do treatments. And that actually, and no pain meds, by the way. There were no pain meds or anti-inflammatories at all during this time, very rarely, because he responded so well to the acupuncture. Just needles and a little electrical stimulation. It sold everybody on acupuncture at the zoo, just put it that way, because of how well it worked. Not animals respond that well, but he responded so well.
I think of it, that's just really amazing. And I think of 2 like immediate things that jump out, because someone who's had acupuncture before. The first thing, 2 things that jump out as issues. The first would be like thick skin. They have much thicker skin than mammals. And then 2, when I had that acupuncture, same treatment, needles are in, and then you have the electrodes on and giving you a little bit of a current. You have to stay very still. So how do you get through both of those problems?
Multiple needles. So sometimes it doesn't work.
Yeah.
They have the osteoderms in her skin, and which is pretty pronounced. And I kind of had a feel for where the gaps were. And sometimes I just, I hit the bone, try a new needle, a bent type thing. But I kind of got the feel where the areas were. So a little difference from the mammal side of things. So I had to extrapolate a little bit from my knowledge of Komodo dragon anatomy to dog/human anatomy for the acupuncture points. So we had to make some changes, and I also consulted with some more acupuncture knowledgeable individuals, and we all agreed that those are probably about the right places to do these points, and just try to hit the needle in there. Once you get the needle in, it's in. Once you get through that skin and those osteoderms, it's actually not that bad. At the very beginning, when I did his needles, he didn't move. He just stood there the whole time. But what was kind of cool is that towards the end of like the more intense therapies together, he would start getting up towards the end and just start walking.
With the needles in.
With the needles in. And he's always kind of done that anyway. And yeah, I'm sure it kind of smarts a little bit. But the good thing is that they're super flexible needles. So there's a little bit of a flexing going on. But I'll sometimes stop the treatment early. He was like, I'm done.
Yeah.
And for those who've had acupuncture, that there's couple different effects. You get the localized effect on the actual joint, where you get the Western medicine description, like a TENS therapy or things like that, where it closes off the pain signals to the brain. So it kind of numbs that area by overstimulation. There's the Western thought. But there's also the other part of the Western thought where it actually sends the signals up to the brain and releases all those normal enkephalins, the opioids, and all the happy drugs within your brain. So you're making your own pain meds.
Right.
And I don't know, I know after I've had electroacupuncture session, for treatment for like my back and stuff, I feel like I'm so relaxed and almost stoned because it feels so good in your brain. You're like, wow, I feel great. This is awesome. And now all those chemicals are in your brain, and your body's just trying to heal itself and balance all that out. And it's the same thing with him. You could just tell that he felt so much better during the therapy. He's like, I'm done. I'm walking away now.
Yeah. That's amazing. So is it mainly for that pain relief, or is there something happening in the tissue as well that's loosening up, tight muscles and whatnot, or is it basically just pain relief?
All the above.
Okay.
Depending on what your goal is at the point. Yes, you can have those little trigger points, the myofascial trigger points, where you have that dense tissue knotting. In his case, he never really had that much tissue knotting in there. I'm sure there probably was, but of course with the osteoderms and the way they're kind of developed, it's kind of hard to feel those. But in dog and cats and humans, I mean, you could feel your own those trigger points form. And yes, and chiropractors call it dry needle therapy, where they put a needle in those points. Arasti practitioners don't use needles, but they use their fingers and thumbs to break down those myofascial points. And of course, Chinese medicine, they call it points. And that what those are basically the knots that they stick needles in for acupuncture points. So it's all the same concept, just approaching it different methods.
Yeah.
I did not use it quite in him, though I have used it in other species and other animals and myself. But in his case, I kind of palpated the areas. There's a couple different techniques where you can kind of find those weaker areas or areas knotted up a little bit. So I did place some points, or I would adjust my point placement sometimes to find those.
Yeah, it's the dry needling side is really fascinating too. For myself, that's like some of the most effective relief of tight muscles that I've ever felt. It's kind of a weird feeling when you do it. So I could imagine it being pretty effective with animals as well, because they're probably getting knotted up and whatnot. And so moving forward away from that specific Komodo dragon, is this a practice that you use quite often for just pain management for some of the animals at the zoo?
I have used it over the years. Probably need to do a little bit more. But definitely, I think that we can go in and find that animal that has pain, try to isolate that area, and use things like electroacupuncture. Sometimes the birds, they don't like to sit still for a longer period of time. So in those cases, I'll do what's called acupuncture, which is injecting a little bit of a liquid. Sometimes I'll use B12, for example, in the acupuncture points around the areas, to try to get that same effect. And sometimes that actually could be a benefit as well. Some of the bigger birds are a little bit easier, because you can imagine a finch is a little harder to put needles in. But I have done some little birds, but in those cases I use like an insulin needle and a little bit of B12, and I'll just basically hit those individual points and just put a little bleb of B12 in each of those little points. And it's hard to say sometimes if you see response or not. So some respond well, some not as much. But I know hitting those areas has the effect of putting that little hole there that stimulates it. Then putting that little B12 there will kind of add that little prong thing. And B12 makes people happy anyway when you do B12 injections.
That's right. Yeah.
That might have that little bit of extra side effect too. So yeah, we'll do that. I'll do that as well.
Yeah, it's fascinating. It's definitely something that I'm sure will evolve over time, along with that whole physiotherapy and whatnot. Well, Dr. Koch, we covered a lot today. Is there anything that we didn't mention that you wanted to say before we officially wrap up?
Boy, I could talk for probably 6 more hours if you want, but we can talk other things later if we ever want to come back.
We'll have you back on for sure.
There's so many different things out there. I think that reptile medicine is at a good point. I think we're now, with combining the husbandry parts of it, that we're getting better at. And I think we're combining that husbandry with the actual medicine part, and we're starting to push the envelope. There's more university programs that's doing reptiles and reptile research and projects. I think we're now hitting a good stride where we're taking that basics that we've already covered the last so many years, and we're pushing the envelope further. And I think that's where we're going to be headed, is in that future stuff that's going to be really cool.
Yeah. Well, and it's a perfect opportunity now, to mend this relationship between keepers and vets. And as, reptile vet med becomes more popular, we're going to have more people going into those fields, and we can actually establish quite a robust, amount of information and practices to help grow this, herpetoculture in the right direction.
Absolutely.
Yeah. Can you let everybody know if there's a place online where they can come say hi? I'll say, as I always do, please don't reach out to Dr. Koch for free vet advice, but is there anywhere where someone can say hi?
I don't have a particular website or anything individual, but I do have people reach out to me on Facebook. So you can just look up Rob Koch online and they eventually find me and message me. I get a few random people text me about certain things. Every once in a while, I'll get tagged on different forums and groups to help consult on a case or talk about some different things. But I don't mind. If it gets to be too much, I'll just ignore you or just kind of sort of say, here's this, go talk to your regular vet. And there's nothing wrong with that. But, I can only help so far, being a whole country or 10 states away.
Exactly.
But, I don't mind helping out little things here and there. But yeah, no, I definitely think that I'm just the tip of the iceberg when it comes to the amount of vets that's coming out that's really loving reptiles. I mean, there's reptile residency programs. We're turning out more reptile-specific veterinarians. And we could talk about exotics on another topic, but so many new faces there that's into reptiles. And I think it's just awesome seeing where we're going.
Yeah, well, it's a very exciting time, and we'll definitely have you back on to get into some more of these topics because I think, like you said, we could talk all day. So thank you so much, Dr. Koch, for coming on the podcast, and it was a blast chatting with you, and we will 100% have some more in the future.
No problem. Thank you.
All right, that is the end of that episode. Dr. Koch, thank you so much for joining me. I really enjoyed our conversation, and we'll definitely have to do a couple more in the future because there's so much information we can learn from someone like yourself, especially with the sort of the breadth and the experience that you have. It is wonderful to listen to, especially just from a hobbyist perspective. So thank you so much. Listeners, if you enjoyed that episode, make sure you let us know in the YouTube comments or just share the podcast on any social media platform. If you want more information on the podcast and the podcast network, head to animalsathome.network.com. And if you'd like to support this show financially, you can do that over at patreon.com/animalsathome. And also you can support our sponsor, Custom Reptile Habitats. You can head to the affiliate link that is in the show notes or the YouTube description. That is animalsathome.ca/CRH. That is an affiliate link, so if you do make a purchase, a small commission comes back to me at no extra cost to you, and that really is a very easy way to support the show, especially if you are in the market for a new enclosure or any other reptile equipment. Then you're just basically, helping support the show by doing your regular purchases that you need to do to manage your reptile room. But of course, don't purchase anything if you don't need it, but if you are in need of something, you can head there and take a look at what they have. And I think that is it. Again, it feels like such a long time since I've recorded an intro and an outro. I feel like I'm forgetting a bunch of things, but I think that's it. Yeah, let's leave it there. I have some amazing episodes coming up. I always say that because it's always true. There's some wonderful people on my list that I have. I've already recorded a couple, and I cannot wait to share that. And I also cannot wait to share this build project and the process of transforming the reptile room and the podcast studio into something I'm super proud of. And potentially we'll have to tell you guys the new animal that I might be getting. That will be confirmed later this afternoon, so I won't say anything now, but if it does happen, I'll have to let you guys know in the future. Maybe I'll let you know in the Discord for those of you who are on the Patreon or the part of the Patreon group, and I will stop there because at this point I'm just talking to talk. I will catch you guys in the next episode.